There are many unmet needs in the management of Parkinson's, both in relation to understanding of the condition and also treatment of the condition. The key unmet need would be really to make sure that we understand the prodromal period of Parkinson's. In other words, we really have the timeline of the journey of a patient with Parkinson's sorted out. At the moment we start our treatment, probably too late, because by the time the motor symptoms appear, the patients might have had the condition for a fair length of time. So to understand the prodromal period and to be able to give a diagnosis earlier and to provide neuroprotective treatment at that stage is clearly an unmet need, and more research needs to be done. The second unmet need would be to understanding of the non-motor aspects of Parkinson's, a major driver of quality of life in Parkinson's. And at the moment, the evidence base for treatment of the various non-motor symptoms, which can range from dementia, depression, to sleep disorders, to pain, is really very poor. So we need to understand that too. A personalized medicine for Parkinson's is a very relatively new concept, and its specific mechanics are being developed by my colleague Nataliya Titova, and it's a concept that has been used very successfully in other conditions such as cancer, such as rheumatology, and so on. So personalized medicine would mean that you tailor the treatment for Parkinson's based on the need of the individual patient. And that could be driven by their clinical subtype, that can be driven by their personality, that can be driven by their age, their disease duration, as well as genetics. So all these elements need to be considered and attended to before the personalized medicine treatment can be delivered. And that's how I think medicine should go in terms of treating Parkinson's in the future. Well, the personalized medicine strategy needs several enablers, and these would be things that I mentioned now, like age, genetics, clinical subtype, disease duration, ethnicity, body weight, lifestyle. And what we would ideally need is some sort of a checklist that is completed by the physician or the nurse or whoever is caring for the patient, and the patient themselves. So you have a patient participation as well. And that will then give us some sort of a score which can allow us to see what treatment might be most ideal for that particular patient based on the personalization of treatment. And that is a toolkit that we will probably need to develop in the future.